Welcome to another edition of the Dementia Care Partner Talk Show. Now, here's dementia care expert Teepa Snow and your host, Greg Phelps.
Nursing homes, care homes, long-term care, lots of different names, but basically it's large groups of people gathered together receiving some form of assistance. Many countries, care facilities are amongst the hardest hit. So our topic today is, are they still a good idea, or is it time to think about reinventing the wheel? Joining me today is Teepa Snow and Joanne Westbrook. Teepa, can we reinvent the wheel, or are we too far into this?
Wow. It gets really challenging as soon as we add the question of insurance, medical coverage, or money. Because these things all these systems are set up and funded by governmental or third-party payers. And to establish something different would really require a rethinking and repurposing. Our system of care was basically designed to bring people together who had common sort of threads of need. And by combining them into one space, we would make it more convenient for the providers of care to deliver services by splitting their time among several people in isolated individual rooms, but then a common space where we could monitor and provide the core services, sort of like a hotel. And I mean, it's built on that model of a hotel or a hospital. The challenge, I think, is looking outside that. We've done it, but it's uncomfortable. So that's where we came up with assisted living, smaller groups, group homes.
Medical model was basically the old ward system, wasn't it?
Yes.
I'm old enough that I actually spent time in a ward, and it was
So did I.
rows and rows of beds, no walls, no curtains, no privacy, and we've sort of.
Well, they had the little rolling stands with the curtains on them that you put around when you were doing something real private, like a bedpan.
You didn't have to put on a show.
You know what you were doing behind the curtain.
So we've come a little ways from there.
We have.
But
I mean, my days in the VA, there were 4 beds in a space with the curtains around the beds, but with one shared restroom between the 4. And then it came to where everybody had semi-privates, which were two to an area and one shared bathroom. And then, we came to the idea, well, everybody needed their own bathroom for a variety of reasons, or maybe not, but that was sort of some of the thinking. And then in dementia, we started going back to, well, maybe 2 to a sleeping space, but then come on out into the common space, because we said at the time that being alone, being in a solo room wasn't necessarily the best for somebody, as well as it was more costly to do it with one to a room. So, there was lots of thinking, some of it thoughtful and some of it just cost containment, to be honest.
Convenience.
Yeah, convenience. Mm-hmm.
So if Teepa was to hit the pause button and say, going forward, this is what I would really like to see, how can we address some of the concerns that have been exposed? I mean, the 4-bed unit gives people some socialization, but one bathroom presents a risk for passing on viruses or other illnesses. So what would Teepa's ideal building or facility look like?
I think it would look like the human beings that we're serving. So for some people, being in community is very important. And so maybe we have to create some private going to the bathroom spaces, but being together in a dorm room, if you would, is something they actually benefit from and enjoy. And it's part of what gives them pleasure. Whereas others want some more private space. I mean, they really want a place to sleep, a space to sit. They want their own privacy. And that's pretty much what you look around, you see human beings being human beings. And by trying to gather everybody together in uniform people, I think what ends up happening is nobody's satisfied with anything, because you try to do too many different, put everybody in a round hole so that you can get them all in there. And it's like, all they want to do is get back out. So I think, what we're going to need is multiple models for multiple lives, because some people have chosen different lifestyles their whole life, and it's probably not going to stop just because they're a certain age or a certain health condition.
Joanne, what's your experience been like with different facilities?
Well, a lot of it for me has been the level of care that's needed. I mean, there are certain people that are really basically like hospital level that, can't get up to go to the bathroom, those kind of things. But when you're adding the dementia piece in there, I agree with Chief. I think that socialization is key. And this is why it's so hard right now with keeping them isolated, because they're going down so fast. But I love the idea of those small little assisted living. I've run a few of them myself that had memory care, only because you were able to do all of those activities, keep them happy, provide the care you needed because it wasn't overwhelming for the staff. But then again, if the level is very high, you're going to need more staff to care for that. So it's complicated.
It is complicated. I think one of the things we've done historically, which I view as not very helpful, is separating out family as though they aren't part of life and seeing them as a sidebar or seeing them as separate instead of, okay, so now we're forming a bigger team. So this was my original team. I was an independent human being. I saw my family occasionally. Then my family and I came to an agreement. They were going to support me more and I was going to be part of their daily routine. And then we got to a place where it needs to be a bigger team. But to start discarding people along the way seems like a mistake. And I think that's what we've done historically is it's a takeover. Yeah. So I give up and I pass you on rather than let's work on this together. Let's figure out what's a good option for me. How about if I try this? What if we try that? Could we still have relationships or is it an all or none? And I think that's where that medical model, I think, really gets in our way. Yeah. Because it's sort of this or that. And I think it's a combo. I mean, yes, sometimes I might need some medical guidance or my care needs might be high, but it doesn't mean that I can't have those care needs met by people who are smart people. They're just not medical people.
Right.
In our country, Canada, there seems to be more calls now for some government oversight, perhaps federal government oversight, to sort of set some standards for each province. It will be the same for you, I guess, each state, so that at least people knew that there was a bar had been set.
And you hear me sigh.
I heard your sigh.
It's sort of like limbo. I mean, and so it's like, no matter where we put the bar, it feels like everybody's like trying to wiggle around the bar. And it's like, well, what's the minimum number of helpers you need? And it's like, well, it depends on who you're helping. How many minutes do they have to have of time? I mean, this whole thing of, what's the minimum instead of what's good care look like? Do people want good care? Well, then what's it look like? And in backing away and sort of saying, what's your plan? Would you like to go to the hospital at some place? Nope, not on my schedule. Well, then let's reallocate my funds because, normally you guys would spend X amount on somebody like me going to the hospital, but I've already told you I'm not doing that. So, it's an advance directive. It's a choice I'm making. And I don't want to change my mind. I mean, that's just a belief I have about going to the hospital in a certain place in my life. So it's like, okay, well, that one's off the table. So that's saving somebody a lot of money. So what if we reinvested that money somewhere else? But it's sort of like, well, no, we'll just keep it for the hospital. And it's like, but I'm not going there.
We don't seem to have the money to address the problem, but we seem to have money to try and fix the problem after it's already happened. So. No. But it's like that with so many things in life. You look and you wish that you could spend money on prevention and everything else. So yeah. I guess we're not going to solve all of the problems of the world on today's program, Tifa. That probably means we have to come back at least once more.
Son of a gun. But I would say, Greg, I think the real answer is it's not all of one thing or the other. And one of my greatest concerns is after all this is over, all we're going to have is a bunch of new regulations. Don't change care in a good way at all. I mean, because that's certainly what, in my estimation, has happened during this crisis. It hasn't been a good quality care. It's just let's stick a sock in it and see what we can do. And it's like, so, I mean, in many places, there's not any reporting going on right now. So we don't actually know. And then all of a sudden now we need reporting because we need to know how many of these cases and da-da-da-da-da. So it's like, get the whip out or ignore the problem.
Yeah, you get the government involved, they want reports.
Yeah. And it's like, so now I'm spending my time doing reports versus doing care.
So Tifa, it's like the surveyors when they come in and they say, well, you have to get them out of bed at 6 a.m. It's time for breakfast. And that person doesn't want to get up at 6 o'clock in the morning. And then they wait 3 hours before they have breakfast. Surveyors. Oh, no, bad.
Yeah. So people who make rules and follow rules without understanding the purpose of some of the rules you follow, which is, why would I get up at 6? Well, if I had my last meal at 4:30 in the afternoon and it wasn't much, well, then probably I should get some nourishment between 4:30 p.m. and 9 a.m. But does that mean I have to get up out of bed, get dressed, and go down the hall? Or could somebody bring me a little something so I could have a snack and then go eat later? I mean,
Well, Teepa and Joanne, we haven't solved the problems of the world, but hopefully we've given people something to think about. Teepa, if people want more information on any of the programs that you're offering, I know that Positive Approach to Care is reinventing itself constantly. That's the reality of the world right now. What new things do you have, and where can people find more information?
Yeah, we actually have a couple of DVD content areas on where should I get my care, what kind of support should I get, what makes sense for me. And that's available if you get up with our folks on the website at info@teepasnow.com, or come on and chat, and we can actually direct you if you have some specifics. So, it's a big topic and it's a big arena. So we sort of always want to ask first, well, tell me more about your situation before we just point you somewhere and then head you down a highway that isn't the one you were looking for. So it typically takes a little conversation on this one.
And you have a website full of information.
We do at teepasnow.com. Just check us out. And if you have questions, one of the very first things it'll say, do you want to talk to somebody? And say, yes.
A real human being?
A real human being, 30 minutes for free.
Not a computer.
No computer involved. Well, you might want one if you want to do a Zoom, but other than that, it's a real human on the other side.
Joanne and Teepa, thank you very much.
My pleasure. Thanks, Greg.